Hi, good morning everyone. I am Mario Gravita and today I'll be discussing to you the initial treatment for acute injuries. So what do we mean by PRICER? PRICER is simply just an abbreviation for 6 words. P standing for protection, R standing for rest, I standing for ice, C standing for compression, E standing for elevation, and R standing for referral. So the first one is protection. So what do we mean by protection? Protection, it means that we need to take away the injured person away from the area where she or he gets the injury. We need to do this so that this person would not get any furthermore injuries that might happen to him. The second one in the abbreviation is rest. Rest is we must remove the person from the area. It reduces the chance to get more injuries, reduces the blood flow, is to allow the persons that will assess the injured person to assess the injury. The next one would be ice. Ice means apply ice bath or ice pack to the injured area to cool down the injured area specifically, which constricts blood vessels, reduces blood flow and fluid leakage, and less swelling, pressure, and pain. Compression means compressing the injured area with elastic bandage or cohesive bandage. We compress the injured area so that external pressure reduces fluid leakage and bleeding into tissues. It also provides support to the injured area and immobilizes the area in rest. It would be letter E, or what do we call elevation. We just simply elevate the area above height or the height of your chest. This is because it reduces the bleeding as blood flows uphill. So the gravity helps swelling to move towards the lymph. The last R, which means referral, because we need to refer the injured person to the nearest physiotherapist, hospital, or doctor. Simply because they're more professional, they know what procedures must be done in order to treat the injured area. The sooner the treatment begins, the sooner the injured person will recover from the injury. And PRICER protection, rest, ice, compression, elevation, and referral. That's all you need to know about applying first aid treatment to an injured person with an acute injury. So thank you for listening.